Good afternoon again. Again, if you have questions, our speakers will be in the hallway in the back. There's consultation rooms, so if you have a specific question, make your way back there, and they'll be happy to answer your questions. To our wonderful vendors back there, I'd just like you to request that you keep in mind that we have speakers going on while you're also networking and marketing, so if we can just maintain a reasonable level, that would be appreciated. Again, if you wanted to go to another room to see another speaker, now is your time. And next, it's my pleasure to introduce Lauren Sutherland. Lauren is the Quality Control and Certification Specialist with Fawcett Memorial Hospital. Lauren is a Southwest Florida native born right here in Charlotte County. She started her nursing career in 2010 with a focus in medical surgical, post-operative, emergency room nursing. Prior to working at Fawcett Memorial, she gained experience in the home health industry, rehabilitation facilities, and long-term nursing care. Today, Lauren will be speaking on the topic of sepsis and what you need to know. Please join me in welcoming Lauren Sutherland.
If everybody promises not to rush the stage and get within 6 feet of me, I'm going to take this off. I know it's exciting, but whew, no mask. This is crazy. I can't believe that we're all here. It's been so long since we've been in groups together, so I'm thankful to see you all. It's been a long time that I've been locked up with my children, so I'm grateful to get out. Thank you for inviting me. It's been a long year and a half, so we're glad to be back out in the community and learning new things. So I think I have a presentation coming up here somewhere, right? No? Yes? Maybe? Hello? Oh, we're working on the presentation. All right. Good. Well, in the meantime, thank you for that lovely introduction. My name's Lauren. I work at Fawcett Memorial Hospital across the river. I'm born and raised right here in Punta Gorda, so people at work refer to me as a unicorn. I'm hoping they're referring to me as a unicorn because it's unique that somebody is born and raised here, not because I'm weird. Could be either one, not sure. Ah, there she is. Okay. Presentation's up here, guys. So Lauren Sutherland, we're going to talk about sepsis. So why is sepsis relevant to you? And let me start by asking, how many people have heard of a heart attack? Everybody, almost everybody. How about a stroke? You're having a stroke. Lots of people know about strokes, okay. So sepsis is sort of underrated. How many people have heard of sepsis or heard of some more than I thought? So that makes me glad. So sepsis is prevalent. It kills up to 11 million people each year, over 49 million cases annually. So a significant healthcare concern is related to sepsis. Only 50% of cases of sepsis survivors will recover completely. So if you are unfortunate and develop sepsis in a hospital setting and you end up going home, only 50% of the time are you going to go back home being the Lauren that you were prior to getting sepsis. And the long-term care that's needed for patients who develop sepsis and end up making it home can be difficult. The rest of those folks who don't recover completely can have long-term disability or issues related to that infection and the recovery from that infection. So very significant statistics associated with sepsis, and that's why it's important for us to talk about it and be aware of it. So I know that you all want to go to nursing school today. So I thought I would mention some of the signs and symptoms associated with sepsis. And what we talk in the hospital and the jargon that we use in the hospital is SIRS criteria. So SIRS criteria stands for Systemic Inflammatory Response Syndrome, but you don't need to remember that. Coming through the pandemic, I think that we're sort of all experts on this now after dealing with COVID, but we're looking for folks who have a temperature. So a high or a low temperature is significant when we're talking about a sepsis infection. just as dangerous as spiking a very high fever, it's also very dangerous if your body temperature drops low. If it drops low, it can be just as dangerous as if it's high. So I'm a nurse, and I would say that a temperature doesn't really make me excited until it's over 101 or it's less than 96. I think that everybody in America has probably bought a thermometer since March of 2020, so we should all be ready to go with our thermometers to be able to take temperatures at home, so that's a good thing. How many of you guys know how to take your own pulse, to check your pulse rate? Couple? So I would recommend you learn how to do it. It's pretty easy. You could feel up here on your neck or in your wrist, and you count over 60 seconds, and you're counting beats per minute. So how many times do you feel the beat per minute? But a fast pulse rate is significant because it can be a compensatory mechanism of your body if they're dealing with an infection. So a pulse above 90 beats per minute is pretty significant, unless you have an underlying condition that your heart always beats that fast. But knowing yourself and knowing your body is important with that one. So a pulse above 90 beats per minute is important to recognize. Breathing fast or breathing quicker than normal, shallow breathing. So I say if you're breathing more than 20 breaths per minute, that's pretty quick. Usually somebody breathes around 12, 14, maybe even 15 breaths per minute. So counting how many breaths per minute somebody has is important. If they're breathing fast and trying to catch their breath, it could be a sign that something's wrong. The last part, I don't think everybody's really walking around knowing what their white blood cell count is. If you are, you're doing way better than me. I have no idea what mine is, but it's something we measure in the hospital, and a white blood cell count can be indicative of an infection. And, leave it to the medical experts to look at your blood work to determine it. Like I said, if you've just had lab work and you know what your white blood cell count is, feel free to share it with a healthcare expert, but the truth is that's something we look at the hospital. So those SIRS criteria, the temperature, the pulse, and the respiratory rate are significant. And those items, changes in those indicators in conjunction with a sign of infection is significant, and that's when we want to start treating sepsis as being an emergency. Just like a stroke or a heart attack, we want to get to the bottom of that infection and start treating so that the patient or the person doesn't go further down the cascade of inflammation. So in the hospital, we sort of talk a lot about the steps of sepsis because it's progressive. It starts out with some type of infection, develops into sepsis, can develop into severe sepsis, and then septic shock. And when you get to septic shock, it's hard to put the train in reverse. We want to catch it early in the continuum. So the reason why I tell you this is that just like a heart attack and just like a stroke, sepsis is an emergency, and we want to treat it quickly. We want to make sure that our doctors know that we're experiencing these signs and symptoms and that maybe we need an antibiotic, maybe we need to be hospitalized, maybe we need fluids. And I'm going to talk a little bit about that later on in the presentation. But the point is that we have a little bit of time in the beginning when an infection is developing to treat it in order to have better outcomes. So, oh wow, this is what I was just saying. We're looking to treat early in the continuum. So when there's an infection, we want the infection treated so that we don't progress onto more unfavorable parts of the sepsis continuum. So I've talked a lot about strokes and heart attacks and traumas, and the reason why is because I feel like every time I talk to patients, they tell me, I know the signs of a heart attack. I know that if I have chest pain, arm numbness, jaw pain, I should call 911. I know the signs of a stroke. I know that if somebody's face goes numb, one side of their body goes numb, they can't move or they can't speak, that can be a sign of a stroke. But if you ask somebody what are the signs of sepsis, they don't know, yet sepsis is more deadly than a stroke or a heart attack. So it's significant to get it out into the community that sepsis is important, and it's something that we should be looking for with ourselves, with our family, with our loved ones, and with anybody really. So in the hospital, what I tell the nursing staff and the physicians is that every hour that we delay antibiotics in a patient that is septic, we are decreasing their survival rate by 8%, and that's pretty significant because an hour isn't a very long time. I'm supposed to be speaking on this stage for a half an hour, so that's 4%, you know? So if you think about it in increments of time, and think about if you are sitting at home and thinking, I don't know if I should go to the doctor's office, or I don't know if I should go to the emergency. I don't really want to go to the waiting room. I'm nervous. What if there's nothing wrong with me, right? I caution you with things like strokes, heart attacks, and sepsis to go. Always go and use 911 instead of driving yourself. I get really nervous. I work in the emergency room usually, and I get really nervous when patients tell me, I think I'm having a stroke, so I drove here. And I'm like, oh, use EMS. They can get you here faster, and they can get you to the appropriate facilities that have the services that you need. But sepsis can develop quickly, and the most frequent sites of infection are lungs, urinary tract, and anything in your abdomen and pelvis. And when we talk about the abdomen and pelvis, I mean your digestive tract, your stomach, anything that can get an infection and potentially. I'm a nurse, so I don't know how to not talk gross. Sorry. So I'm going to just say anything in your belly that can bust or bubble or get an infection in it, it's a place that we focus on a lot in the hospital. But lungs and urinary tract are very high up on the list of places that get infections that lead to sepsis, because it's not necessarily the infection that can be so dangerous, but the inflammatory response associated with sepsis that is most deadly. So who's at risk for sepsis? And I wish that I could give you like a magic list of folks, but the reality is everybody is at risk for sepsis. We see it a lot in our pediatric population and our mother-baby population. So postpartum patients are also at high risk for sepsis. But also, in addition to infants, children's, mothers, older adults are at high risk for sepsis. And the reason why is because they have a lot of comorbid conditions that put them at higher risk. So certain conditions like diabetes, kidney disease, liver disease, wounds, these all put a patient at higher risk for developing sepsis. And we don't know what genetic triggers put people at a worse predisposition of developing sepsis, or what specific pre-existing conditions put somebody at higher risk. But I think as a country, we all saw this when we went through the pandemic, right? How many people do you know that got COVID and were walking around and were fine and were like, well, you know, I had a scratchy throat a couple days and I spiked a fever of 99, and then other people were having to be hospitalized, put on a ventilator, didn't do so well. So we saw that with the pandemic pretty significantly, and it's the same for sepsis. You know, people developed sepsis as a result of COVID even. So sepsis is universal with any infection, both bacterial and viral, and can develop on anybody. So when we're talking about who is at risk for sepsis, unfortunately, it's all of us. So that's why it's important for us to know. Why do I have to go to the hospital? So I'm the worst. As a nurse, I'm the worst patient. I hope that you don't judge me, but I'm the worst patient. So I would probably be thinking the same thing you are. Like, why can't I just deal with this at home? You know, I've got maybe a wound or I have a UTI. Like, why do I got to go to the hospital? What's the big deal? I can drink some fluids and keep my fever down and stay home. So if you are improving clinically, you're not getting worse, you're keeping your fever down, you're on antibiotics, it seems to be doing well by you, no, you don't need to go to the hospital. However, if you're sick and continuing to stay sick, these are some of the reasons why I tell folks to go to the hospital. So we at Fawcett take sepsis really seriously. We treat it just like strokes, heart attacks, or any other trauma situation that comes through the door. And there's a lot of blood work, antibiotics, and IV fluids that go on with all of our sepsis alerts. So something called the lactic acid is drawn, and that's a lab that we do to determine how well oxygen is being distributed in a patient's body. So that's kind of the short version of what a lactic acid is. But the higher the number, the not good somebody's doing. So that's the first thing we do when you come to the hospital. We like to draw blood cultures to see if you have cooties in your blood. And if you do have cooties in your blood, we want to know what kind of antibiotics will kill those cooties. So drawing blood cultures is the second thing that we do. We administer IV antibiotics. IV works quicker than antibiotics that you take by mouth. So IV antibiotics is the gold standard of somebody who is experiencing symptoms of sepsis or that we diagnose with sepsis. And we give a really big fluid bolus to patients with sepsis. Typically, the kidneys is one of the first things to take a hit when somebody has an infection and their blood pressure drops. So we make sure to give people lots of fluids to sort of build up their intravascular space, or the amounts of fluid in their body, so that their blood pressure doesn't drop and that blood continues to flow to all your vital organs. Because in really extreme circumstances, if patients have a huge dip in blood pressure, their kidneys can fail, their liver can fail, and we can have some detrimental outcomes from that. So these are all of the things that our hospital staff is evaluating when a patient comes in with an infection that could lead to sepsis. Beyond that, there are some medications and some assessments that go along with sepsis that are significant for those patients who end up in ICU. So we have a very tight process around our sepsis cases, and we take it really seriously, and that's why we want you to come to the hospital, because we want you to have the best outcomes. This slide is not interesting if you're not in the healthcare field, so you don't have to put too much into it. But I like to talk about this because it's kind of newer technology and something that we do. So remember I mentioned that we give our patients fluids when we suspect sepsis. And the reason why is because we want to keep them off of drugs that will we want to maintain a good blood pressure so they have good flow through their body and all of their vital organs are getting blood. So in the past, it was really frightening to give some patients fluids. Patients who have kidney problems or patients who have heart problems can't take too much IV fluid, or they could have a hard time breathing, particularly our heart patients. So we have this new technology where we put it's like a blood pressure cuff on the end of your finger, and it helps us determine how well your heart is beating so that we can determine how much fluid that we can give you. It keeps the patient a little bit safer because we don't want to give somebody too much fluid and then hurt their heart. You don't want to try to help the infection and then hurt the heart. So this is sort of new. In the past, we were kind of guessing, how much fluid does someone need? The textbooks tell us they need 30 milliliters per kilogram. So for a normal person, that's between 2 and 3 liters of fluid. It's a lot of fluid. But if you have a bad heart, it's risky to give that much fluid. So something that we use is called EV1000, and this is just a picture of what that looks like, and clinically how it helps us determine how much fluid to give somebody. So another reason why you're in good hands when you're in the hospital is because we're thinking about these things for you. Also, we utilize early surveillance on our patients, all of our patients, to determine whether or not they could be at risk for sepsis, because we don't want them developing sepsis once they're admitted. So we try to make sure that we have really tight grips on their vital signs, their laboratory results, their physician orders, so that if somebody starts to look fishy or start to look like they're developing something that could lead to sepsis, we treat them on the spot rather than watch and waiting. So early surveillance is a key to survival with sepsis, just like treating the infection early is the key to survival. So when should I call 911? And I mentioned this earlier in the presentation because a lot of people load up in the car and they drive to the hospital when they feel as though they need medical treatment. But what I like to tell people is that sepsis is a medical emergency and time matters. So if there is somebody with an infection and they're having associated confusion, they're not able to talk like they normally do, make decisions, they're having cognitive issues, which is associated or closely maybe linked in timeline to an infection, that's significant. Shortness of breath, remember I mentioned counting how many breaths you have per minute as being important. If someone's not able to catch their breath or they're breathing rapidly, that's a significant sign that it's time to get medical attention. I talked about the high heart rate, so learning how to take your pulse and counting how many times your heart beats in 60 seconds. Anything over 90 is usually considered abnormal unless you have a pre-existing heart condition. So counting your pulse and seeing, is it beating very fast or is it normal? Shivering or feeling very cold is usually a sign that you have a fever. So measuring your temperature and treating that fever. Extreme pain or discomfort. I think that everybody sort of walks around with some degree of pain, just because if you're here long enough, you might have something that causes you a little pain or discomfort. But new pain, debilitating pain, or significant pain is never normal, so please don't ignore pain. And clammy or sweaty skin can also be a sign of a fever. So keeping that in mind, these are some of the symptoms that I think you should look for if you have an infection and you are thinking it could be sepsis, either for you or someone you care for or someone you love. How can I prevent sepsis? Well, like I mentioned, since we don't know what always triggers sepsis in every patient, because there's a genetic component, there's a pre-existing condition component, getting ahead of it's sort of one of those universal things, just like we talked about with COVID, right? Wash your hands. Everybody's so sick of washing their hands, but please keep up the good work and wash your hands. Getting your vaccinations on schedule is also significant. I know that as a county, we just went through the process of all of us getting our COVID vaccinations, so keeping up with your flu vaccinations and any other vaccines you might be due for when you go for your yearly annual with your doctor, keep up with your vaccines. Take steps to prevent infections or the conditions that can cause infections. So I always have to put in, as a healthcare provider, that quitting smoking and maintaining a healthy weight and an exercise regimen is significant. Nobody likes to hear any of those things, but I feel like it's my due diligence to say all of those things. And act fast and get medical care immediately if you suspect sepsis for you or someone you love. If the infection's not getting better and you're getting worse, don't hesitate to reach out and get help. These are some good-looking folks here. So I work with some of these nurses, and also Max Lopez there. He is our liaison with Charlotte County EMS. And again, I'm Lauren Sutherland. I work at Fawcett. And I'm thankful that you guys took the time to listen to me and talk about sepsis. I think that I'm going to be at a table in here to do some Q&A with whoever wants to chat. And maybe I can see you guys at the tiki bar later, depending on what you're doing. So I hope you guys have a good day. Thank you for allowing me to come visit you all, and take care.